Hello, this is Lance Anderson from the Subiaco Foot Clinic. Last episode we spoke about some ways to release those tight structures around the heel for people in that pain phase of plantar fasciopathy. And today we're going to talk about some ways to further reduce pain and fast track that healing process.
In his 1978 bestseller, The Sports Medicine Book, legendary sports doc Gabe Merkin first coined the term RICE, rest, ice, compress, elevate. In the 4 decades since, his memorable protocol, especially the ice and rest components, have become an article of faith among wounded warriors everywhere. But what if RICE is wrong? Although icing can provide temporary pain relief, more and more research is showing that it may actually be slowing down a person's recovery from injury. On top of the poor evidence towards icing, the current thoughts on plantar heel pain is that it's not an inflammatory problem anyway, it's a degenerative problem. And icing that frayed and damaged fascia isn't going to help heal it any faster. We need blood flow and natural healing and lots of it. That's why the advice we give to every person in this acute pain phase is to rest that heel on a warm wheat bag whenever they can. This includes when sitting at work, watching TV, any other time they're sitting down. There's no time limit on this, just the more the better. And believe me, after doing this for a few days and seeing that pain relief, people want to do this. And generally it's only required for a week or two. A simple wheat bag from the pharmacy or your local podiatry physio clinic is all that's required. The other short-term method we almost always use for plantar heel pain relief is compression. At the clinic we apply what's called the low dye taping method using sports tape which compresses the plantar fascia and also limits its stretch. This is usually kept on for 3 days, but in my experience patients generally don't want to take it off because they can finally walk again without pain. This taping is something you'd find difficult to do at home yourself, but you can purchase compression socks from a pharmacy which will give you some of the same benefit. So for the record, that Dr. Merkin who came up with RICE now openly rejects at least half of the advice that helped make him famous. So instead of RICE, I think it's time we found a new treatment acronym for people in that pain phase of soft tissue injury. I've heard a few thrown around, but the one that I would suggest and follow at the foot clinic is CHARRT: compression, heat, active recovery, and release therapy. We've been through compression, heat, and release therapies, and next episode we'll talk about that active recovery component that's the first step towards being active, pain-free again.